Welcome back to CVM News at Noon. April is Autism Awareness or Acceptance Month, which is dedicated to fostering understanding, inclusion, and acceptance of individuals on the autism spectrum. However, persons living with the condition as well as parents don't think enough support, research, and attention is given to autism. So let's have this conversation. Joining me now in studio, we have Dr. Alua Tumaleo Bewaji Edokpa, and she is a consultant pediatrician and founder of Bola Health Medical Center. And also on Zoom we have Kelly Simon. She's a parent whose child has been diagnosed with autism. Now let's start with you, Dr. Edokpa. Sometimes parents dismiss children as being disruptive, are them rude, are them antisocial. What are some signs that parents, family members can see from early to determine this child or this individual may be on the spectrum?
Thank you. So these are children who you may find you're speaking to them and they are not responding. It's almost as if they're not hearing you, or as if they are locked up in a world that's separate from you. So they may not make eye contact, they may not point and show you things that they're interested in. They may just not engage as much as another child of the same age. And this is usually noticed from very early. Less than 2 years old. We have a screening that we do at 18 months, that's very important, where we'll look at what their social interaction is. Do they have any repetitive patterns, things like, hand flapping, spinning around, we call that stimming. Is there anything that they do that is rigid? Are they able to move from activity to activity, or are they just very inflexible? So those are some early signs that we can look out for that may point to a child who has autism. What's
usually the age that children are diagnosed with the condition? And also, can you say roughly perhaps how many children we have in Jamaica right now living with the condition?
So we've had some estimates of 1 in 36 children will have autism. And what some of the pediatric developmental pediatricians will tell you is you have been in school and had classmates who had autism. Because what happens in Jamaica is often we don't actually know that the person may have autism. We are getting to a point where we're more aware. And so you may actually find diagnosis being made by the teachers. Teachers are becoming very good at making the diagnosis. Or even parents may notice that something is different about a classmate. So there is that increase in awareness, and persons are diagnosed later. We even have some being diagnosed in high school, and some adults just notice that they have certain difficulties and they go in and get formal assessments. Typically, diagnosis should be made by about age 2, but in our population, we're still catching up and we're still finding some persons diagnosed later.
Just before I bring in Miss Simon, we find that persons with the condition are usually hypertensive to light and sounds and textures. How can we control this or help them whenever they're exposed?
Right, so hypersensitivity is a very important factor because we live in a world that is very loud, very colorful, very chaotic. And someone with autism may not be able to navigate that as easily. So having less noise, if we're having a function, being cognizant of how loud the volumes are, having the capability of having headphones for that person, support in terms of dimming the lighting. And for children who are in school, they may need to have a shadow, somebody who's with them to help them to navigate that school setting.
All right, Miss Simon, you're on Zoom. Your child is now 9 years old. At what age did you notice that your child may have had autism, and what were some of the information that you received when you reached out for professional help?
So my son is 9, as you said, and he was diagnosed at around 2. I started noticing some of the early signs from about 18 months. And that was in a period when I transitioned, we migrated from Jamaica to Canada. And the early programs that they had, these city programs they had, they would give you these milestone instructions. And then if you had any concerns, they would ask you to see a pediatrician where you could do the assessment.
How would you say the support has been in terms of getting the medical treatment for him, and also the type of support that he has had to receive at home?
So once we received the assessment, in Ontario, where I live, we're given interim funding, and you're able to purchase services such as ABA therapy, that's applied behavior analysis, speech therapy, occupational therapy, and a lot of other things that could include respite or technology support materials. So each province is, so I'm just talking about this in respect to Ontario, where I live, because each province is responsible for healthcare. And so those are the services that you're able to do in the interim until you are able to get core clinical services, which is limited to ABA analysis, speech therapy, occupational therapy, mental health services.
Describe some of the challenges you've had raising a child with autism.
So early on, he's always been verbal. And so that's really helpful because with a nonverbal child, you have to find other means to communicate. So he's verbal, but he was, as Tommy was mentioning, or you're referencing earlier, very hyperactive, more than a normal child, or doesn't listen. So you have to repeat things over and over and over. And what the system does is what the system does allows to give you those supports, especially in a classroom situation. Where each child in Ontario has, with ASD, has an individual education plan, and they're able to structure those supports around each child with a diagnosis. So, yeah, that would be some of his challenges. But intellectually, he's at grade level. So I consider myself quite fortunate. But it's mainly social challenges, difficulty making friends, and people would consider him socially awkward. And then when he was younger, extremely hyperactive, don't listen, don't make any eye contact, and so on.
Dr. Edokpa, there are also different spectrum levels which requires various level of support for each child. How exactly can parents, though, approach each level to better help their children?
So I think it's very important that once we recognize that there's a child who has delays, whether in speech or just the way that they socialize or communicate, then we get a formal assessment done. And that assessment can guide you in terms of where on the spectrum is your child. Are they more on the severe end of the spectrum where there's limitations in verbal communication, expressive, receptive, or are they more on the higher end of the spectrum, or less intellectually impaired, and where they're able to fully communicate, but they still have that social awkwardness. They may still have challenges in terms of comorbidities with ADHD, which is attention deficit hyperactive disorder, or comorbidities with sleep disorders. They may even struggle with things like constipation, etc. So it's recognizing that first step is getting a formal assessment done, and then figuring out where are we on this spectrum, and then tapping into the supports that are available. There are limitations in terms of what can be done for a family that doesn't have means in Jamaica. I think autism spectrum is very dividing. You have those who have means, and so their child can get speech therapy, can get occupational therapy, can get ABA, which is the applied behavioral analysis, but then you have those who just don't, and so they're kind of stuck in this system where they're waiting to get assessments done, they're waiting to get into the like microcare, waiting to get into having a shadow. So there really is kind of a divide based on what your capabilities are financially. So getting the support that the government offers requires first getting an assessment, often requires a psychoeducational assessment, and just getting things started quickly because everything takes time.
So speaking of support, my final question, I'll throw it to both of you, 10 seconds each. What more do you think can be done to better navigate the environment, the social issues, and the repetitive behavior associated with autistic individuals? Let me start with you, Ms. Simon. What more can be done in 10 seconds?
Well, education is, as more aware, this is important to make us aware, everybody aware of, the differences that we have in our population. And the second thing is funding. Funding. We can't have a future, these people are going to grow up into adults, and we need to think of it as a priority to fund the supports so that these children can, develop into adults that are able to manage the world that they're going to live in.
Dr. Edokpa?
I think that's a good take home, that we need to support persons with autism because they will grow up into adults, and we will have to navigate a world where we have persons who need to be able to function in some capacity. So if persons without means who are from lower socioeconomic statuses are not able to afford the support services, then those are children who had potential which is kind of locked in. And it's finding a way to help them to unlock that potential so they can kind of optimize their abilities and can contribute to society as they grow.
All right, thank you so much to both of you, Dr. Edokpa and Ms. Simon, who's on Zoom, for shedding a light on this very important issue in this Autism Awareness Month. Let's go now to a break, but stay with us. Sports is next.